Hi Satya, tell me about yourself.
Good morning, ma'am. I'm Yas Satya. I'm coming from Kadlur. I completed my UG BSc Biotechnology in Acharya Arts and Science College.
HIPAA full form.
Health Insurance Portability and Accountability Act.
Angina pectoris means
Severe pain, chest due to blockage of coronary artery due to atherosclerosis.
what is the Roman number of olfactory nerve?
Roman number 1, cranial nerve.
Cholelithiasis means
Stones in gallbladder.
what are the regions of small intestine?
Duodenum, jejunum and ileum.
What is fracture and its major types?
Fracture is the breakage of bone or cartilage. It can be divided into two types: pathological factor and traumatical factor. Pathological factor can occur in any diseases or condition. Traumatical factor can occur in trauma or other accident. It can divided into two types: open fracture and closed fracture.
What is dysphagia?
Difficulty in swallowing.
What is puerperium period?
The period of sixth week following childbirth.
What is COPD?
Chronic obstructive pulmonary disease.
What is neoplasm and its types?
Any abnormal growth of cells and tissues. It can be divided into two types: benign, malignant. Benign does not spread to surrounding tissues. Malignant can spread to surrounding tissue. Carcinoma in situ, partially developed malignant.
Explain guidelines of myocardial infarction.
Myocardial infarction, insufficient blood supply in the coronary artery. Guidelines: check whether STEMI or non-STEMI. STEMI, segment elevated myocardial infarction. Non-STEMI, non-segment elevated myocardial infarction. The subsequent myocardial infarction code should be second attack and occurs within 4 weeks of first attack at same location.
Amniocentesis means
Surgical puncture to drain the fluid in the amniotic sac.
explain seventh character of ICD-10-CM code in detail.
Extension is the stages of issue or issue of encounter. To visit the doctor in the doctor office. It can be divided into three types: initial encounter, subsequent encounter, sequela encounter. Initial encounter is the first visit in doctor office. Subsequent encounter is the second visit in doctor office. The sequela encounter is the third visit in the doctor office after complication in injury.
Layers of skin.
The skin can be divided into three layers. Epidermis is the outer layer, dermis is the middle layer, subcutaneous layer or hypodermis is the innermost layer.
Convective masses.
The heart contains some specialized material is known as conductive tissue. These tissue are generate electrical rhythmic impulses. It can be divided into four types: sinoatrial node, arterioventricular node, bundle of His, and Purkinje fiber.
What are the categories of diabetes?
Diabetes can be divided into two types: primary diabetes and secondary diabetes. In primary diabetes can divided into two types: type 1. Type 1 is also known as juvenile diabetes. It is a insulin dependent diabetes below 30 years. Type 2 diabetes is the non-insulin dependent diabetes. It can occur in above 30 years. Secondary diabetes can be three types: due to underlying condition, due to drugs and chemicals, other specified diabetes
What
mellitus.
is glaucoma?
Damage of optic nerve.
Encephalitis means
Inflammation of brain.
medical term of kneecap.
Patella.
Total number of bones in an adult, children, and fetus.
In adult has 206 bone. In children has 213 bone. In fetus has 306 bone.
Explain functions of heart in detail.
The superior vena cava, inferior vena cava carry deoxygenated blood to right atrium. From the right atrium, the blood passes through tricuspid valve into the right ventricle. From the right ventricle, the blood pumped into pulmonary artery. The pulmonary artery carry blood to lungs. The lungs of alveoli, it can be oxygenator. The pulmonary veins carry oxygenated blood to left atrium. From the left atrium, the blood passes through mitral valve into the left ventricle. In the left ventricle, the blood pumped into the aorta. The arterial system The blood pumped to throughout the body, it reaches to capillary bed. In capillary bed, the exchange of oxygen and carbon dioxide can be take place. The venous system transport deoxygenated blood to superior vena cava and inferior vena cava. This process repeated continuously.
Explain guidelines for external causes.
External causes guidelines, place of reason for injury, place of occurrence, activity, and status code.
What is spexing?
Surgical fixation.
Okay, Satya. Thank you.